PHI working group meetings, but AMIA has decided to make most of these pre-symposium workshops as half days. So we have packed as many as presenters into the agenda. Apparently the agenda email was blocked by some email server at Hopkins, so you didn't get it, and actually I had to send it out through my Gmail account this morning. So the agenda, we did not print it. We want to be, informaticians, and for once send it electronically. So it should be in your email list. If you don't have it, at the end of the my opening remarks, you can see the link on where you can download it. So, so you're here at the PHI Public Health Informatics Working Group's pre-symposium event. This year, we are focusing on the social determinants of health and what are the challenges and opportunities we have both in public health and population health informatics. This is the agenda that I've sent out this morning, both myself and Christina Steffen, whom I'm waiting for her to arrive, co-chaired this sort of a half-a-day symposium. We had a program committee that helped us to select sort of the presentations. They are in the room. Thanks for all of their help. John Looms, Brian Dixon, Harold Lehman, Roland Gamashi, and Susan Salkowitz. So this is the list of speakers. I'll just show you the agenda. We just had one cancellation. Mike Fried couldn't come. But then Roland Gamashi actually accepted to present something on behalf of Mike. So the agenda for today, so I just saw Christina walk again, so I'm happy now. The agenda for today, after the opening, we have the keynote, and then we have our first panel before the break. There'll be 4 presentations. Again, this is very packed. Compressed presentations. We will not have the time for the moderators to introduce each of these speakers. So the bios are attached to the email that I've sent out this morning. So you can read it there. There is a link to their bio and their web page, so you can find out more about the speakers that way. If the speakers want to present, introduce themselves, that's fine. But we just want to be conservative on the time we have. Then we have like updates. These updates are very short, only 5 minutes, about some news, something happening in public health, population health informatics field. We will have a break, and then we have another panel and another update, and then a summary and closing. And basically, we'll finish at noon. This is the agenda. Just showing you who's going to present. Hopefully you have received it by email so you can look at it. By the way, there is also, during the break, those tables in the back of the room. There'll be myself and Ashish Joshi. We will talk about a couple of the initiatives that we have. There is a population health informatics book that was just published, so he can actually talk about that with you, and he has some samples that you can look at. We are thankful to Regan Street Institute for sponsoring the breakfast. This is very helpful. It gives us enough coffee to go through the entire day. So thanks for doing that. So round of applause. And specifically to Sean Granis and Brian Dixon for making this happen. And then also CPHIT or CPIT, the Center for Population Health IT, has sponsored the video recording of this session. So hopefully the link will be shared with you after this meeting. I will acknowledge the students who are helping me today. If you're an attendee, make sure you can talk to Stella and Priyanka. You've probably met them out of when you're walking in, but if there are any issues, you can talk to them. And Gurmir and Mehdi are doing the audio video. So if you have any slide issue, if you're a speaker, Gurmir and Mehdi can help you out on that. Oh, by the way, before I finish, that is the link. If you, for some reason, did not receive the email that was sent this morning, you can just type that in. It'll bring up the agenda. So, so it's sort of It's one of those Google shortened sort of URLs. So that concludes my opening remarks, and now I want to invite Christina, the co-chair of this event, to introduce our keynote.
Good morning, everyone, and welcome. We're so glad to see so many of you here today. As you might have heard, our session actually completely filled up, and then we started a wait list. So I would like for all of us, if you don't mind, to just take a minute and raise our hands to Hadi. He has spent the last several months working so hard to pull together a stellar group of individuals and presentation topics for us. So Hadi, well done.
So